Dr. Jess here. When it comes to lipedema and lymphedema, we want to use the body set. At the core of both of those issues, there is a major fascial dysfunction that is contributing to the condition. And we know that anybody enduring this condition is quite frankly already going through enough. So we use the fascia flow body because it picks up a vast amount of tissue at one time. To show on my arm, you can see the amount of tissue that it picks up. We can go up, which will be more gentle. Down is a greater pull. We have to reconfigure the fascia in order for them to let go in both conditions. When we have lipedema, that, symmetrical extra fat that is usually in the legs of women that is disproportionate to the body is caught up and entangled within the fascia. They cannot separate. Now, when it comes to lymphedema, we know that that is a problem with the lymphatic system in being able to drain. Well, your fascia houses your lymphatic system. So at its core, it comes down to the fascial dysfunction. We get the fascia being able to unblock. We allow the lymph to flow. So when we're working with the legs, with both conditions, you're going to want to just roll up all the way through. Roll all the way through, all the way around to your comfort. You can go in both directions with this. It is really going to depend on what feels okay for you, because as you know, I teach, we will not bruise and we are not going to hurt ourselves. If we have an extreme area of tenderness, we are gently going to pulse. So say right here, I was really tender. I would take the edge of my deluxe and I'm gently going to pulse. You can see there's barely any pressure being put on this tool with my hands because I have designed these tools at toes top level that the material is going to do the work for you. Why you want the deluxe in this is because we have 3 sides here that are going to offer a release. And we are going to start with the face of it where there are going to be the release nodules here. You will be able to go back and forth. This flow is fine. This is not supposed to be a workout for you when you are already enduring enough of exhaustion and just mental fatigue in and of itself for what you're going through. We go back and forth here, but the final push needs to go towards your lymphatic drainage point. There is a free download on my website that you can look at where you want to give that final push to get that sludgy waste out of you. So after you do the face of this, you will move to the smaller teeth on the deluxe. This may be where you end. If this is all you can handle, this is all you're going to be able to handle. If you can go a step further, you will go to the larger teeth. This is going to be the final exhale, but you're not putting a ton of pressure on this. You're just allowing the tool to do the work to break up those fascial blockages and get between those sheaths. Your protocol is going to be 2 to 4 times in a week until you can get to maintenance. Maintenance level is going to look like about 1 time a week once you get to the place that feels good for you. My little assistant. If you have any questions, please let me know.